I'm Dr. Kirsten Fulong here from Pinnacle Chiropractic, and today I'm here to talk to you about INSiGHT scanning and what we do in our office. So we're going to look at the body through a different lens. What we do as chiropractors, and more specifically as pediatric chiropractors, we're looking at the body in a very different way than most practitioners you're going to meet. So we get a lot of questions all the time on what exactly we do and how we measure it. So if you are looking at the lens of the nervous system, especially as a chiropractor, you must be scanning it and measuring it. And that is so important, especially when you're taking care of kiddos. So this is what we do in our office. I'm going to show you an example of a scan of a kiddo that we just most recently scanned. He is actually only 3 years old, and we're just going to see how much stress he's holding in his little body. So the nervous system is the master controller of the body. It is important for that brain-body communication that you have constantly happening between that brain and that body, where all these signals are going back and forth. So when this nervous system gets bogged down with interference or stress, things will not work as well as they should. All these organ systems of your body will be affected, where the muscles and the movement are affected, the hormone cascades are affected, the digestive system's affected. All these different things will be affected if even just one organ system is not functioning at its best. And so this can wreak havoc on the brain and create a lot of interference in the brain, where you might see a child that it's not that overwhelming or overstimulating of a situation, but all of a sudden, like, loud noises are just too much for them at that moment, and they actually need something like headphones to wear or something to just calm them down, because they're all of a sudden in this stress mode from just something that a loud noise just happened. So we're going to dig into the neurology of this and how we help these kids that have these struggles happening. So oftentimes when kids come in, there is a symptom or a struggle. There's not just kids coming in where everything's fine and dandy. Parents are just looking for wellness, even though that is our ideal type of patient as well. We do have a lot of kids that come in with many different needs. And so a lot of kids are struggling these days with a lot of overwhelm and a lot of issues. Things we see often are anxiety, sensory overwhelm, chronic gut issues, and immune system challenges over and over and over. They might be getting sick 1, 2, 3 times a month even. So when we hear symptoms like that, we want to see what system in the body is that linked to or connected to. Is that system in the body dysfunctioning? And how do I see that it's dysfunctioning? Do I just feel it? No, I'm actually seeing it on a scan. So this is why we love to use these scans. We need some objectivity with our practice. We need to see what's going on, and it's a window into what that nervous system is actually doing at that moment. So here's an example of a thermal scan. I'm just going to pull this up right here. So right here you can see this is a 3-year-old, and he's got a lot of noise happening. When you look at this scan, you don't really see calmness. You're going to see a lot of stress. We measure this as more significant inflammation when there's a lot of red bars. When there's blue or green bars, that's more moderate to mild inflammation. And then when there are white bars, that is normal, healthy body heat coming off that scan. So basically this is like a big fancy thermometer that we run gently up that child's spine, and adults if we have them in our office. We can even do these on babies and just modify our equipment to help them. So basically we're using a big fancy thermometer that's running up their spine and just measuring areas where there is significant heat coming off that body. So normally, we should see no color on those scans. We should see very minimal color, if so, maybe just a little bit of green. But this child definitely has a lot going on. There's definitely a lot of bogginess in that child system. There's a lot of noise going to that brain, and that's interrupting all the signaling and all the communication within that body. So this is a reflection of the autonomic nervous system, or what we call the automatic nervous system. This is where your heart is beating on its own. Your lungs are breathing on their own without you even thinking about it. The digestive system is moving along. All the things that you don't have to think about, that autopilot mode day to day that your body does naturally, which is awesome. So if the nervous system has stress, like I just showed you in that scan, in one of those areas, the brain will pick up on this. And it kind of sends like an alarm signal off, and other symptoms will also be affected, and other systems will also be affected, because the nervous system has to work harder to overcome that stress that's happening. So this scan is showing faulty signaling essentially. So this is a Wi-Fi signal that's not too strong for that child. And so that's why it takes this child more effort to do everyday things, automatic things for their body, like digestion, deep breaths, focusing, sitting still. This causes them to have struggles where their behavior is now interrupted. Their sleep is now interrupted. And all these different things are happening as a cascade of effects because of that interference that we're seeing and all that heat and extra energy that that body has to output because of all the internal things happening within that system. So yes, we are looking at the symptoms, but we are also taking a deeper look towards that root cause for where that child is experiencing that stress in the nervous system. And this is just one of 3 different scans that we do in our office. So if you have questions about this, if this sounds like your child, if you think that they're just getting overwhelmed with simple things throughout the day that don't really interfere with your life, that is going to make an impact for that child. So we want to make sure that these kids are being checked for that nervous system interference and making sure that their brain-body communication is as clear as possible so that everything is functioning at its best, because we don't want this to turn into chronic issues like gut issues, immune system challenges, sensory issues. All these different things that we see in our office are all related and connected to one thing, and that is the nervous system. So if this sounds like you or your child or a child that you know, please comment below. If you have any questions, reach out to our office. If you even want to see our scans, this is a really cool way of showing you what's going on within your body that you might not be aware of. So this is really cool for us to get regular scans on ourselves as well, and just to see what's really going on and what our body is telling us. Thank you so much. I hope you guys have an awesome day, and I hope this suits you well.